So welcome everybody. Today we're going to be talking about the Affordable Care Act and the reporting requirements under the Internal Revenue Section 6055 and Section 6056 areas as it pertains to the employer mandate and the individual mandate that we know is out there as well. So we're going to be talking, there's a lot of different areas of compliance as it pertains to the ACA. So today, all we're discussing is the reporting requirements. There are a lot of other areas that, we would have the opportunity to discuss at a later time, and there will be some other webinars coming out on that. So in order to get started, I'd like to just run through the agenda. We're going to be talking about that reporting, why you have to do the reporting, who has to report, what information actually has to be reported, and how are you going to report that. And whenever we're talking about this reporting, just know that there's two pieces to it. There's the piece where you have to report to the employees in your organization or to the individuals who have health insurance, and there's also reporting to the IRS. So before I get into the actual forms and what's going on, I'm going to just kind of back up and give you a little background as to why this is going on. What is this? What's actually is this all about? So under the Affordable Care Act, in Title 26 of the Internal Revenue Code, there was a new section added called 4980H, which talked about the employer mandate of applicable large employers if they did not comply with ACA requirements. Now, sometimes I'm sure you've heard of this as the pay or play rules, or Part A and Part B penalties, or Section 6055 and Section 6056. And they're all very similar. They're all related to the same thing. So the first thing to know is applicable large employer. So this is employers that have over 50 full-time and equivalents, full-time equivalent employees in the previous year. So for 2014, if you had more than 50 full-time employees, including those equivalents, you are considered an applicable large employer. Also under this Affordable Care Act, there was another section added called 5000A, and this addresses the individual mandate and the penalty that may be applied to each individual who may not have health insurance during the calendar year of 2014. So there's the employer mandate, Section 4980H, and Section 5000A, which is the individual mandate. So now to the reporting, you have Section 6055 of this 4980H that requires information to be reported by any entity that is providing minimum essential coverage to any individual. So this mainly applies to health insurers, your carriers out there, or government plans, but it also includes self-insured employers. So if you self-insure your medical plan, and remember this is only about health care, the medical portion. So if you self-insure your health plan, then you are required to report under Section 6055. All size self-insured employers. Under Section 6056, it's only if you are an applicable large employer do you have to report information on what coverage was offered to the employees and which of those employees have coverage and their dependents and the premium amount that you are charging. Now remember that the reason for this reporting is because of the employer mandate and the individual mandate. So the Section 6055 reporting is necessary for the IRS to enforce the individual mandate, and 6056 is to enforce the employer mandate. The Section 605 reporting, again, the self-insured employers and insurance carriers or entities that provide minimum essential coverage. So this is going to be reporting that is done to individuals. So if you have, if there's anybody on this call that is a small employer considered a non-ALE, and you are getting your health insurance either directly through the carrier or through the Vermont Health Connect, then you would not be required to do this reporting, even because you would be fully insured through the exchange. So let me just make that very clear, because we have had some questions on that in the past. All right, let's move on. So under the Section 4980H, there are two different penalties that an applicable large employer could be subjected to for various reasons. So the first part of it, the penalty A, says that if you do not offer minimum essential coverage, all right, to substantially all, which for 2015 is 70% of your full-time employees, and those include equivalent. So FTEs in this sense stands for full-time equivalents, employees and children to age 26. You do not have to offer minimum essential coverage to spouses. All right, now most of you probably do, and that's okay, but you do have to offer it to your employees that are considered full-time, and full-time is over 30 hours, and their children, their dependents, up to age 26. Now, in 2016, geez, I almost said 1996, where am I? In 2016, that percentage that is considered substantially all increases to 95% of your full-time employees. So for this year, if you can show that you have offered this minimum essential coverage to at least 70% of your full-time employees and their dependents up to the age of 26, then you would not be subject to penalty A. Oh, there we go. And this penalty is triggered if one of those full-time employees who you did not offer coverage to went to the exchange and enrolled in subsidized exchange coverage. So if they went to the state healthcare exchange and they received a federal subsidy helping them pay for that coverage, then you may have to pay a penalty not only on that full-time employee, but all full-time employees. The penalty is 1/12 of $2,000 per month times all of your full-time equivalents. Okay? So just one person that you don't offer coverage to goes to the exchange and gets a subsidy, you could be penalized a lot of money for that. This exactly for 2015, they're going to let you exclude the first 80 full-time employees if you did have to pay a penalty. So in that instance, the chances of you getting a penalty under the penalty A clause would be pretty slim. But it could happen if you didn't offer insurance to a large group of your employees. You could get hit with a penalty. And this amount, this 80 full-time employees, reduces to only 30 in 2016. So this is being implemented a little at a time. The second penalty that you may be subject to is called the penalty B. And this is only for applicable large employers who fail to offer coverage that is affordable or meets the minimum value. So if the coverage that you're offering, meets that minimum essential coverage as an employer group plan, it would meet that coverage. But your plan does not meet the minimum value, meaning that it pays approximately 60% of all the costs that the employee could incur. Or if they could not afford your coverage, then you would be subject to penalty B. And these penalties are triggered when there's one full-time employee who finds the coverage is unaffordable, and then they enroll in subsidized exchange coverage again. Or if your plan does not meet that 60%, then you will get a penalty of 1/12 of $3,000 a month per employee who received the premium credit. So for this penalty, it's only multiplied by the number of employees who go to the exchange and actually receive a federal subsidy. So it's a little bit less than what you might have to pay under not offering coverage. And the reason I'm going through these is so that you can see how it ties into the reporting and why it's important that you understand these penalties so that you're able to fill out the forms correctly as well. So let's talk about affordability for a moment. In order for your plan to be considered affordable, it cannot cost your employee any more than 9.5% of household income. So that's what it was for 2014, and that amount is actually going to be indexed every year based on CPI, which is the Consumer Price Index. And for 2015, that amount increased to 9.56% of household income. But from an employer standpoint, are you necessarily going to know what your employee's entire household income is? Probably not. Right? Not unless everybody's working for you, and even then, they may have other outside income that you're not aware of. So the IRS came up with what they call safe harbors. And they said, we understand that you as an employer may not know what someone's household income is, so we're going to give you 3 other ways that you can determine affordability of your health plan. The first one is called a Form W-2 safe harbor, and this is based on W-2 wages from you, the employer. So you would know what that W-2 wages are for your employee, and it can't be more than 9.5%. This is the key with safe harbors, is the safe harbors are not indexed. So it's going to always be 9.5% if you use a safe harbor. So you've got the Form W-2 safe harbor, you have a rate of pay safe harbor, and this is just taking your employee's rate of pay multiplied by the number of hours they normally work per week or per month and coming up with a premium amount that does not cost more than 9.5%. Or you have a federal poverty level safe harbor. And this affordability is determined, they base it on the federal poverty level for a single individual. Now for 2014, that amount was $11,490, and I have not seen the 2015 rate yet. It may be out there, but I have not had an opportunity to go research that. And again, if you use the safe harbor, you have to use the 9.5% to determine affordability. Okay, so Section 6055 is reporting the actual coverage the employee had or the individual had. Because remember, health insurers, if you are a fully insured health plan, your health insurance carrier is going to do this reporting. Okay, they're going to do the Section 6055 because it reports on the actual health insurance coverage. And this is going to be used to enforce the individual mandate. So the employee's name and their date of birth and social security number and all the dependents, all that information has to be included with Section 6055 so the IRS knows on an individual basis who has coverage and who didn't have coverage because penalties may apply to them. Whereas Section 6056, only applicable large employers have to report under this section because it's reporting on the offer of the health insurance coverage and the affordability of that. So this is used to enforce the employer mandate as well as determining whether there a premium subsidy, whether one of your employees is eligible for a premium subsidy if your plan is not affordable. So how are they going to know who to penalize? Well, we already know the answer to that. There's going to be new tax reporting that has to be done. And one of the big questions that you as an employer should be thinking about right now is who's going to be responsible for this in your organization. I've seen a lot of information out there on a lot of blogs and a lot of listservs talking about, well, it's a tax form, so we hope payroll's going to do it for us, and payroll's going, wait a minute, we don't necessarily have all this information about, did you make an offer of health insurance coverage during any months? And, you know, we know what the premium is, but is it affordable? So HR needs to be involved with a lot of this reporting as well. So something to be thinking about, and maybe some of your next steps, is really looking at where and how are you going to capture this information in order to be able to report it. So I'm going to go through each one of these sections a little more in depth so that you have a good understanding of which areas you need to report on. So as I said, the Section 6055 reporting requires that every provider of minimum essential coverage report that information both to the IRS and to the covered individuals. So health insurance carriers, self-insured plans, government plans, any entity that's providing minimum essential coverage. So self-insured plans have to report no matter how many employees that you have. And here in Vermont, we are the only state in the whole United States under ACA that requires our employers with 50 or less employees to go into the health exchange. So there's no self-insured plans, employers out there that are not applicable large employers also. So keep that in mind, but you do have to report under Section 6055. And remember why this is being reported, the individual mandate. So everybody who provides insurance has to provide information on exactly who is covered and what that actual coverage is. So the information that has to be reported is the individual or the employee, the policy holder, your employer information, issuer or coverage provider. Again, that's like the Blue Cross Blue Shield, the MVP, the Cignas. Covered individuals and their tax identification numbers for everybody on the plan. Now, I know that some of our health insurance carriers have been doing a really good job of trying to gather everybody's Social Security numbers, the dependents on the plan, because that's usually what their tax ID number is. And the IRS has come out with a rule that says that if you can't get the Social Security number, you can use a date of birth, but you have to be able to show that you made a reasonable effort to obtain that tax ID number. And it generally includes 3 times. You initially ask for it, you do it annually, and then you do it once more if you haven't received it. At that point, if you can show that you've asked for dependent information and the tax ID number and have not received it, then you can use the date of birth. But this is an area where they're going to be auditing. When they audit you on this, they are going to audit to see, did you actually make 3 solicitations to get that Social Security number? And then you also have to report the covered months of health insurance. The forms that are being used to report this information are these tax forms. 1095B, that goes to the individuals that are covered, the policy holder. And the B1094B form is the one that goes to the IRS. And the IRS just recently released the instructions. Now, these just came out either today or yesterday. Because as of last Friday, all of the forms were still in draft, but they did come out with the forms. They have them all set, so if you want to download, these links are live, and you can just click. When I send you the slides, you can click on these and see what the forms are. I'm not going to spend time looking at this form. I am going to spend time looking at the 6056 because everybody on the call is an applicable large employer, I believe. And that's the one that you're going to need to fill out. Remember, if you're fully insured, you do not have to report under Section 6055. And, of course, there's going to be penalties. The IRS came out and said penalties may apply if the forms are not filed, but I want to say that they will apply, not may, they will apply. It's $100 per return not filed, and that could be waived if you can get corrected returns filed within 30 days. Now, this first year, the IRS has said we're going to be very lax on penalizing people for not filing the forms correctly. There may be some mistakes on the form, but they will penalize you for the actual penalties under 4980H, not offering coverage, etc. Section 6056 reporting. Remember, who has to report is applicable large employers. They're going to report information about the health insurance coverage that they offered or didn't offer by, again, doing these statements to the IRS and to the full-time employees. So the first time that these reports and statements are due is in January of next year for the 2015 calendar year. So some people may say, well, that's a long ways away, January next year, but it's good that you're here listening to this now, because you need to start thinking about how you're going to gather this information. If you outsource your payroll, you might want to work with them to see where they are in providing assistance. Or if you have an HRIS system, you might want to check with them to see if they have reports that you can run. It's a new ball game for a lot of people and a lot of companies out there. So everybody's kind of scrambling to get all the information and get systems in place to be able to just print these tax reforms like you do your W-2s. And remember, again, why people are reporting under 6056 is for the employer mandate and the employee's eligibility for premium subsidies. Now, there is transition relief for employers that fall within that 50 to 99 full-time equivalents. There's not going to be any penalties this year if you didn't offer coverage to everybody, or if you did and it wasn't minimum value, or you didn't offer it to all the people that you should have, okay? But you still need to report. The reporting is still necessary. Even though you won't be penalized, you still need to file reports. And you're going to have to file information to show that you are eligible for this transition relief. One of the documents, one of the resources that you have talks about what is the transition relief and how can you apply for that, if or not apply, but how does it apply to you if you fall within this full-time employee number. And under the Section 6056, what has to be reported? Your employee information, your information with a contact info that the IRS or the employee can call. You have to show that you offered coverage by month to your employees. The amount of the monthly premium has to be reported, and that premium is only the lowest cost plan for self-only coverage. Okay, so lowest cost plan, self-only coverage. That's the amount that you need to look at for determining your affordability test. You also have to report which safe harbor you used, if that's applicable. If you used the W-2 safe harbor, a rate of pay safe harbor, you have to report on that form which safe harbor you used, and it's all code driven. There's codes in the instructions that you have to put in certain boxes. Other information that's going to have to be reported to the IRS, the number of full-time employees for each month, the total of all employees for each month, and then the employee's coverage effective date, and was that affected by a waiting period. Now, we know that when you hire somebody and you know that they are full-time benefit eligible employees, you have that 90 days that you have to offer them coverage. You have to get them enrolled if they want the coverage within that 90 days. But the IRS also came out with this orientation period and said, well, if an employer has a waiting period or an orientation period, there can be an additional 30 days that's added to that, or actually in the forefront of that. So you have to know that. Did you have a waiting period of any number of days before the 90 days started counting? And then if there's any third parties that are doing reporting for you on this, you have to provide their information as well. Under Section 6056, you're going to use these forms, 1095-C for that goes to the employees, and 1094-C that goes to the IRS, transmittal of that information to the IRS. And again, they have released instructions. So I'm going to just click on this form because as an applicable large employer, before I do that, let me just make sure we're all on the same page. As an applicable large employer, you have to report under 6056. Okay, and remember that information is which months did you make offers of coverage and what is the premium amounts. Okay, that's what 6056 is about. If you are also self-insured, an applicable large employer that is self-insured, you're going to need to report the information on 6056, but also 6055 because you are self-insured. This one form allows you to report for both sections of the IRS code. So if you are an applicable large employer, you are going to use 1095-C for your employees. If you are self-insured also as an applicable large employer, you will fill out another section on this form, and I'm going to show that to you so that it makes a little more sense maybe. Okay, well, let me see if I can zoom this in just a little bit. Hopefully you can see this. You report information on your employee, about yourself with a contact telephone number so somebody knows they can call you. Part 1 and Part 2 is the Section 6056 reporting. So all applicable large employers will fill out these two sections. Offer of coverage. Now see, it says enter required code. If you offered somebody coverage for all 12 months, there's a code that goes there. But if you had somebody hired in April and you didn't offer them coverage till June, then you would only put codes in these months. Again, the employee's share of lowest cost monthly premium for self-only minimum value coverage. And then safe harbor. If, excuse me. If you used a safe harbor to determine affordability, again, this is where you would put that with a code. Part 3 is if the employer is self-insured. So this is your 6055 reporting. You need the name of the person, which is going to be the same as your employee up here. Their social security number, what months were they covered? Did they have dependents? You list those, social security number or date of birth if it's not available. But remember, you want to make sure that you've done 3 solicitations for that information. And you fill out that information on what's covered. That's it. That's the 1095-C form. It sounds easy. But if you read through the instructions, you'll see there's a lot of codes and a lot of information that will be conveyed in here. So you need to be thinking about your technology. You need to think, how are you going to gather this information? How are you going to know who you have to offer the coverage to begin with using your measurement periods, but also then all full-time employees or anyone covered under your health insurance has to receive a form. So here's these instructions, and the instruction pages are about 14 or 15 pages long for that. Well, sorry about that. So an applicable large employer who is also self-insured will report for both sections on one form. So if you're an applicable large employer but you are fully insured, then you would only report for Section 6056, which would be that Section 1 and 2 on that 1095-C, and your health insurance carrier would send a different form, a 1095-B, from them to your employee that has that Section 6055 information on it. Okay, so even though there's 2 sections for an applicable large employer, there's only one form that you need to be concerned about. And then the 1094-C is the form that gets sent to the IRS that summarizes all your 1095s, and you send it with a copy of the 1095 that you have provided to your employee. So for any of you who are involved with payroll, this is the same as W-2s. You provide a W-2 to your employee, and then there's a W-3 that is sent to the Social Security Administration that kind of summarizes all the W-2s. Same exact thing as it pertains to the Section 6056 reporting. And again, the same thing with 6055, the penalties may apply. There are some alternative reporting methods that are available to certain employers for certain employees. And that is one of the resources that you have in your materials section. It discusses what these particular alternative reporting methods are and how you could do this, but it's a lot stricter. You may want to just go with the general method, which is the forms that we're talking about. It requires different calculations, and you also can look at the resources, I should say, that'll be available to you. So when is this reporting due? It's the same as your W-2 reporting. Your employee statements for applicable large employers, that would be the 1095-C, is due to your employee by January 31st of each year for the prior year information. And then the transmittals to the IRS is due by February 28th if you're a paper filer, or March 31st if you file electronically. And you have to file electronically if you have more than 250 returns to file. You don't count your W-2s and your 1095s together to determine that 250. It's two separate things. So you may have 400 W-2s that have to be done. You have to file electronically, but maybe out of that 400, only 200 of them were full-time employees with these 1095-Cs. If that's the case, you do not have to file electronically. You could file by paper, but just know that there's a shorter deadline to be able to do that. Just like, same thing as with W-2s, okay? So all non-applicable large employers who have self-insured plans, again, this probably won't apply in Vermont. They would use this 1095-B form, and applicable large employer, whether they're fully insured or whether they're self-insured, is going to use the 1095-C with the understanding that if you are self-insured, you fill out all three sections. If you're fully insured, you only fill out sections 1 and 2. So what are your next steps? Again, review that technology capabilities. Does your payroll system and HR talk to each other? Does the systems talk? How are you going to get all this information in one report? You may have to amend contracts with third-party providers. We have noticed a huge uptick in payroll companies coming out with these ACA reporting reports for employers and charging them additional fees or charging them money for a module that, helps them track and do all of this. So, just take a look at what your third-party providers are doing, and if they're not doing something, then you may want to be thinking about who you're going to use in the future, because they need to get on board with this, and you as an organization really should be reviewing all the information that needs to be gathered, which boxes they need to go in this form, and how is that going to be, how are you going to be capable of doing this in your own organization? Who's going to be responsible for this? Also, if you are self-insured, make sure you check with your carrier on whether they're collecting those Social Security numbers of all the dependents. If they're not, then you're going to want to start doing that, because this needs to be reported next January. At least make the initial and second solicitation for the information. Review the IRS website for these FAQs. There's a lot of information in these too. They're in a question and answer format, much easier to understand than trying to read the regulations, for sure. And then watch for the actual forms to be released. They've been released. Yay. So that's good. And also out on our website, the hbhriq.com, we have a healthcare reform resource center as well that has a whole wealth of information out there to help you with figuring all this stuff out. And you certainly can always give us a call as well. In addition to our compliance and support, we also have technology solutions, we have benefits solutions, organizational wellness, and retirement solutions. And we have some other upcoming educational events that you may be interested in as well. These are some seminars that are happening here at Hickok and Boardman. There'll be invitations going out. And also there's going to be a webinar series, and you can find this information on our website right here too. It's health and welfare benefits compliance. This is my information. I'm going to stop for a moment and see if I can see if there's any questions. I know I went through that pretty quickly for people. Okay, can't find the materials section. Above the chat where you're chatting, there should be like these little plus marks. There should be one that says materials with the number 4 next to it. If you can't find it on there, then you will get an email that has a link in it that takes you to that. That's very funny that you can't see that. Let's see if there's something else that I can't. Let's try that. Okay, a lot of people saying they can't see it, so I will make sure if you don't see it. Oh, somebody sees it now. Yay! Geez, I'm learning so many new things about this go-to trading system. Wow, amazing. Okay, that's great. So you can download them now, or again, you will get a link. Does anybody have any questions? Feel free to type them into the chat area. I know this is a lot of information. I also have a new kind of cheat sheet that I'm going to put into a PDF that I will send you. I'll send it to you with the slides from this session, okay? And it's going to walk you through like a flow chart so that you will know which forms and which sections that you need to fill out, all right? I just created this internally, but I'm going to go ahead and, send it out to everybody as well. Okay, so thank you very much. I appreciate your time, and don't hesitate to, reach out to us with questions. We have a wealth of information here we can help you with. All right? Thank you for your time.